Who should get the deep brain stimulation surgery or DBS therapy for Parkinson's disease? As I've mentioned earlier in my other video, that DBS can be useful for many different diseases and has been FDA approved for essential tremor, Parkinson's disease, and is FDA exempt for dystonia. But it doesn't work for every Parkinson's patient because it doesn't work for all the symptoms. And there are things that can get worse by putting a wire in the brain. So it's important to select the right patient. So what is deep brain stimulation therapy's goals or benefit? It does not stop the progression of Parkinson's disease. It does not cure Parkinson's disease. It is only controlling symptoms. Same thing that you can do with medications such as carbidopa, levodopa, and Sinemet. Then why DBS? Because Sinemet in Parkinson's patients with advancing disease can have an effect or benefit that becomes less smooth and less predictable. The benefit kicks in when they take the medication, then it's too much medication, and then it wears off in few hours, then they're off again until their next medication is taken and it kicks in, and so on and so forth. So the whole day is on, off, or fluctuating day, while the brain stimulation is constantly on at the same steady level throughout the day. So, and night, 24/7 actually can be kept on. So the benefits are more constant and more predictably present. So it's mainly done to replace the chemical therapy, the pills, medication that you take, when the benefit of pills are there but not very predictable and not throughout the day and night. So to get the same benefits but in a more constant fashion, then we provide this therapy. That gives us two important points to remember. One, it will only give benefit which are or can be obtained by the medication, by the pills. The only difference being that it will give it more constantly or continuously. And secondly, it's usually considered technically when the benefits of medications are gone or not available for more than a certain time during the day. So at minimum, if there is 3 hours or 5 hours of time when the benefits of the medications are not there, what we call off periods, that's when we consider this therapy to get rid of those off periods and make the day more smooth, but only for the symptoms that are responsive to the oral medications. And we test for that with only one exception, and that's an important exception, which is tremor. That if there is tremor that is not responding to medication, it will still respond to the deep brain stimulation surgery and can be considered.